Okay, so first of all, I want to thank everybody for coming to my class tonight, taking like a half an hour out of your life to learn some things about health and healthcare and how your body works. So I'm going to start out by just asking a simple question. Is there anything wrong with our healthcare system today? Is there a problem with it? Does anybody see any issues with it?
Yes.
Okay, Don.
Pharmaceuticals are way too important or too powerful.
Okay.
They guide too many people in the wrong path.
Okay. Okay. So would come on in, Denise. We got a box seat for you right in front of you. Okay. So would you say then that like is that, if I translated that, would that be they're just too overprescribed or too hard on the body, or what would you say?
False information. They're not proven. It seems like there's all kinds of medication out there that it just doesn't work.
Yeah, and we definitely know that. Yeah, that's true. Okay, and that's been it's been actually documented in journals. So you're saying there's a problem with medication. Okay.
Definitely.
Okay. Anybody else? Yes.
Can I treat symptoms and not root causes?
Okay, so you're saying that we don't treat root causes, we treat symptoms. Anybody else agree with that? Okay. Okay. Anything else? Is it bad to treat symptoms?
Doesn't fix anything.
Okay. Is it okay sometimes to treat symptoms?
Mm-hmm.
Yeah. Sometimes it is. Okay. I'm not saying you should never treat symptoms, but it doesn't really get to the underlying root cause of the problem. Okay. Anything else that's wrong with her? Yes.
So I've kind of wondered, I've been at one doctor for my symptoms and another doctor for the same symptoms. And one doctor's, prescribes one medicine and the other one prescribes a different one. And I go to the one doctor, why can't you just prescribe both medicines? He goes, well, we don't use that medicine. Why is that?
That's a great question. And since I don't prescribe, I'll give you what I think is it. Is that there's certain specialists that use like certain medications. And there's some that just they don't know how to use them because they don't use them enough. So they just refer somebody to somebody else for that particular drug. So yeah, there is.
You don't think there's a more sinister reason?
Well, no. Well, I wasn't. Well, I wasn't thinking about that, but maybe there is. So yeah, I mean, I think that what I found, especially when I worked down at the People City Mission Free Clinic, I did a clinic down there for 6 years on Friday afternoons, and I could always tell which doctor these people were going to just by the pharmaceuticals they were taking. Because when they had very sophisticated neurological pharmaceuticals, I knew they weren't seeing a general practitioner, they were seeing a neurologist. And so if you look at most physicians, they have a certain cadre of drugs that they use that they're really familiar with. This is what they do, this is what they use. And they don't prescribe a lot out of that group because they understand those and they use them. And so, and different physicians have different groups of drugs that they use, okay? And that's probably what you were experiencing there. Like, for example, a general practitioner doesn't use the same pharmaceuticals that a neurologist does. And so that's why they refer back and forth like that. The issue is that pharmaceuticals have side effects. They don't really get to the underlying cause of the problem. And some of them are just so overpriced that over time you can't economically justify the cost of them. Like, for example, 2 weeks ago I did a talk on Ozempic, And the average cost of Ozempic in this country is $1,300 a month. You know, and that's a lot for, you know, that's one drug. So, and it costs $5 to make it. So there's a lot of issues there. So part of the problem with our healthcare system is it's based on symptoms primarily. Not all of our healthcare current medical system is bad, and we're going to look at that. So if we look at current health statistics, the United States spends more on healthcare than the next 10 highest countries combined. We have less than 5% of the world's population. We take 50% of the world's drugs and 80% of the world's painkillers. That's pretty amazing statistics. I mean, are we in any more pain than anybody else in the world? I mean, you've got to think about that. And according to the World Health Organization, the U.S. spends a higher proportion of its gross domestic product on health, but ranks 37th among 191 countries in effectiveness of healthcare systems. The third leading cause of death in the United States is the effects of properly prescribed pharmaceuticals and hospital errors. Okay, and that doesn't count the people that go into a hospital without an infection, get an infection, and then die. That's about 75,000 to 100,000 people a year. So, and by the way, this comes out of the New England Journal of Medicine right here, September 6, 2012. So, you know, our healthcare system does some things really well, like trauma care. I mean, I can tell you what it does well. Diagnostic imaging does really well. Reconstructive surgery, those things it does incredibly well. The problem is that, like the New England Journal of Medicine says, we have unsustainable costs. We don't have great outcomes, frequent medical errors, poor patient satisfaction, and worsening health disparities. So the problem with our healthcare systems is we do a terrible job at chronic disease. We just don't do well at all with, and our healthcare system does not produce healthy people, okay? It produces people that are on medication, but people that aren't necessarily healthy. In fact, I would go so far as to say this. I've been in practice a long time, over 4 decades. I would say that most physicians don't know what a healthy person even is supposed to look like. They don't know, they couldn't describe it. And I've seen that because in these journals that I read, they talk about, you know, putting these generally healthy people on these studies, and they can't define what that is, okay? So that's a pretty bold statement, but that's what I've seen in 4 decades of practice. So if you have a heart attack in our system works well, works really well. But if you have fibromyalgia, diabetes, chronic fatigue, or arthritis, it doesn't work so well, okay? So those are the things we need to figure out. So what is functional medicine? How does this fit in? It looks at identifying the causes of disease rather than treating the symptoms. It seeks to understand the origins of chronic disease so that meaningful treatment and prevention methods can be developed and implemented. So that's really what functional medicine is. What is the underlying cause of the problem? Let's see if we can find that. So we ask 2 basic questions in functional medicine. Is there something in the body that shouldn't be there? Okay? So, are there parasites? Are there hidden bacterial or fungal infections? Toxic chemicals, heavy metals, toxic fatty acids. Where do you get toxic fatty acids, by the way? Anybody know? Everybody ought to be able to raise their hand on that one.
McDonald's French fries.
French fries, that's right. My CA got that one right. Okay, you better. Yeah, French fries, fast food. Okay, structural imbalances, which is what we treat here. Medication side effects, food intolerances. Anybody here ever hear of gluten intolerance? A lot of people have it. Causes a lot of problems in people. Okay. Not everybody has gluten intolerance, but a lot of people do. Toxic emotions such as anger, greed, resentment, or unforgiveness. would everybody agree, or anybody agree, that emotional stress can drive sickness and disease?
Oh, yeah.
Absolutely. That's been absolutely proven, okay? So, or is the body lacking something that it needs? Okay, so it's the second question we ask. Does it need trace minerals? So, what's a trace mineral that the body might need? Anybody know?
Selenium.
Selenium, okay? What does selenium do? Nobody knows. Okay, well, that's all right. Selenium is a very powerful antioxidant, but it's really, really important for thyroid function, converting T4 to T3. So, what's a good source of selenium? Anybody know? Carmen, don't tell them. I know you know.
I'm not.
Okay.
I'm not gonna tell them.
Okay. Anybody know?
Brazil nuts?
What?
Brazil nuts?
Yes. Yes. Brazil nuts. Great source of selenium. Okay. So you might need vitamins, phytonutrients, digestive enzymes, exercise. You might need a more higher diversity of gut flora, or you may just need positive relationships. So when you have a problem with gut flora, what can that cause in the body? When your microbiome in your small and large intestine is off, what problems can that cause?
Inflammation.
Inflammation, yeah. What else?
Anxiety.
Anxiety, yes, because there's this gut-brain connection. Depression and anxiety. What else?
Cognitive impairment?
What?
Like cognitive impairment?
Yeah, cognitive impairment. Sure can. It can also cause heart disease. I had a woman recently, very recently, bring me her studies on, she had all this lab work done on lipids like cholesterol, triglycerides. It's all pretty good. Her cholesterol's high. Her HDL, or good cholesterol, is really high. Triglycerides are really good. And yet she's developing plaque in her arteries. And she wants to know why, because she exercises, she eats right, her lipids are pretty good. She wants to know, why is that happening? And so one of the things that can cause that is a problem with your gut flora can cause problems with plaquing in the arteries and heart disease. How many people knew that? Okay, so this woman wants to know, why am I developing plaque in my arteries when my serum lipids are pretty good? That could be one of the reasons, okay? That's a functional medicine issue, all right? So are the health issues we face in our civilization just pharmaceutical deficiencies? Like 1 in 10 people in America take an antidepressant. So do people have a Prozac deficiency or a Wellbutrin deficiency? Is that why they need that drug? Anybody? No, they're just born with a Prozac deficiency. You know, yeah, this one's got a Prozac deficiency. No, I don't think that's the case, all right? So how would a functional medicine practitioner evaluate somebody with chronic depression, okay? So we could look at gut flora imbalances, food intolerances, heavy metals. How do we get heavy metals? How are we exposed to heavy metals? Anybody know?
Environment, food.
Could be food.
Questionable seafood.
What?
Yeah, questionable seafood.
Yeah, questionable seafood. Could be, we could be exposed to rice is a source of arsenic. Did you know that? Eating too much rice uptakes arsenic.
Grain.
Yeah, so I found that out because I did one on myself, and we had a lot of rice at our house, and my arsenic levels were high, so I'm detoxing from that. Okay, so lack of sleep, poor cardiac function, fatty acid imbalance. Why would this cause? Why would that cause depression?
Because you need fat for your brain.
Yeah, our brains are primarily fat. If you put the wrong fatty acids in, it can't work right. Elevated insulin and chronic inflammation. So, one of the most common drugs prescribed are statin drugs. So statin drugs, they lower cholesterol pretty well, but they also do a lot of other things that aren't very good. So they lower vitamin D, coenzyme Q10, sex hormones, etc. So the problem is like typical side effects of a statin drug would be muscle and joint pain, memory loss. It's really good at lowering sex drive, lowers testosterone, causes chronic lower back pain, diabetes. There's a lot of issues with statin drugs. A lot of people take them. So what would be a good alternative to a statin drug that would lower your cholesterol? Can anybody think of anything right off?
Red yeast.
Red yeast rice, okay, that'll do it, but that does a lot of the same things to the body as cholesterol does. Doesn't have quite the side effects, but it will lower cholesterol. I think there's better alternatives, but that would work. Can anybody think of a better alternative? What's a really natural alternative to lower cholesterol?
Walking, like,
Yeah, how about exercise? Yeah, exercise. Exercise raises your HDL, your good cholesterol, lowers your total cholesterol. Okay. Another one's berberine. Berberine's an herb that I use a lot of. Berberine lowers cholesterol, lowers blood sugar, and it really helps with gut dysbiosis. It does a lot of really good things. So, for example, conventional doctors would normally prescribe pharmaceuticals like Prilosec, Prevacid, and Nasifex to treat reflux or heartburn. A functional medicine practitioner like myself would look for low stomach acid, low pancreatic enzymes, food intolerances, like what kind of foods are you eating? That's a pretty big deal. H. pylori infection, leaky gut, gallbladder dysfunction, hiatal hernia, or just you're drinking too much pop, okay, which could cause acid reflux. All right, so if you look at health issues, the symptoms are like the tip of the iceberg. That's what you see on top. But the massive part of the iceberg, which is under the water, is really the underlying causes, and that's what functional medicine practitioners look for. So William Osler was the physician who actually invented the residency system, and he worked at Johns Hopkins Hospital. And here's what he said. He was really kind of a functional medicine thinker. He said, the good physician treats a disease. The great physician treats the patient that has the disease. So it's more important to know what sort of patient has the disease than what sort of disease has the patient. So I think that's a pretty good quote. He also said, if you listen carefully to the patient, they will tell you the diagnosis. So that's also very important. So here's an example of that happened to me recently, okay? So I have a patient who, she sees me a lot. She takes a lot of good supplements, but she's developing this chronic yeast infection. She didn't know why she was, why am I developing this? Okay. I don't know. I don't think I've done anything different. I'm not on antibiotics. Why do I have this yeast infection? So she calls me, and I didn't know why she did either. I couldn't figure it out. So she called me and she says, my other nurse practitioner upped my progesterone, doubled the amount of progesterone I'm taking. Would that cause the yeast infection? Well, I didn't know. So I looked it up, found an article on PubMed that says too much progesterone basically primes the body, the female body, for yeast infection. So that was the issue, okay? That was a problem. All right, so you've got to know these things, and if you don't know these things, sometimes you can't figure it out. So I called her back and said, yeah, that's probably the issue. So how do functional medicine practitioners find the underlying cause of illness? We take a thorough case history, really, really important. When did this problem start? When was the last time you were well? When was the last time you felt good? Those questions are really important. A good physical examination. So which organs aren't functioning right? Okay. Do you have organs that aren't moving right, that aren't functioning right. You have surgical scar tissue that's actually torquing the tissue and crowding the organs. Those are really, really important things to know. Then we do specific laboratory tests that target specific systems or biochemical functions in the body. So we look at the terrain of the body, which has allowed or propagated ill health. So that, does anybody know what I mean when I say the terrain? Okay. Is that a yes or a no, or
Yeah.
I don't know, or, okay, so if you look at the terrain of the land, okay, so you're driving through a desert, that's much different than driving through a rainforest, okay? Terrain is different. So the terrain of the body is, what is it about the body that's allowing this disease to progress? Okay, that would be the terrain. So we look at things like, how much inflammation does a patient have? Do you think that matters, inflammation? Yeah, it really matters. Really mattered during COVID, because these people that carry high amounts of inflammation, those were the primary people that got COVID and got stuck in the hospital, you know? So chronic inflammation is a big deal, and we can measure that pretty easily. Hormone imbalances is another issue that can be a big deal, like this woman I just talked about. Metabolic disruption, insulin resistance. So is your insulin levels high? What does high insulin cause? Anybody know?
Diabetes?
It's associated with it. It causes it causes a lot of inflammation in the body. Okay, and high insulin is associated with cancer. So the higher your insulin gets over time, the more you're moving towards the direction of some sort of malignancy in your body. Very, very close association. Impaired detoxification. If your body can't detoxify, you know, what happens to those toxins? They're what?
Stay in your body,
Yeah, stay in your body. And where do they stay?
in your gut.
Yeah, they're stored in like fat cells and things like that. Okay, your body your body will hold on to water to make sure those toxins are diluted. So then what happens? Then you can't lose weight. Okay, it's too hard. It's really hard to lose weight. Okay, same with high insulin. Insulin locks fat into the cells. The body can't get rid of fat. Okay, so until the insulin comes down. Immune dysregulation. Environmental toxicity. Are we exposed to a lot of toxicity in our environment? Oh yeah. Look at all our food that we buy. What's it wrapped in? Plastic. Okay, all of it is. You know, I was looking around my house the other day, and like, there's plastic everywhere. You know, I mean, I have a Vitamix which can, you know, practically turn wood into water. You know, and what is this? It's a plastic poly kind of urethane container. You know, so yeah, we're constantly exposed to it. So key diagnostics for looking at the terrain of the body: look at hormones, metabolic markers such as insulin and oxidative stress. I do this test all the time on patients. Very important tests. Fasting insulin tells me a lot. Detoxification pathways. So you're looking at how's your liver functioning. Are your liver enzymes normal? And there's lots of different ways on a blood panel to determine whether the liver is working right. Inflammation markers. So HSCRP, cytokine panels, ferritin. It's a very sensitive test for iron. So if ferritin is high, inflammation is high. So I do HSCRP and ferritin on just about every patient that comes in for a comprehensive blood panel. And toxicity. How much toxicity do you have? One other one I would add to this is the microbiome. Looking at microbiome diversity. You know, how diverse is your gut flora? You know, is it working right? So these are the things that I look for. Okay, so I'm going to talk. There's actually 4 case studies here. So here's one patient I saw. 40-year-old female, daily stomach pain, was getting worse over time, alternating constipation, diarrhea. past gallbladder removal, Crohn's disease diagnosis, chronic sinus congestion. She's been on Prilosec for 10 years, okay? What do you think her stomach acid was like? Prilosec for 10 years. Didn't have much, okay? Because Prilosec neutralizes that. So we found ileocecal valve dysfunction, small intestinal valve dysfunction. This is on the exam, low stomach acid production. So I gave her bile salts for gallbladder, gave her some supplements to help her digest her food, corrected the valves. The result, the stomach pain is much better. She gets occasional mild pain. She has way more energy, better focus. Bowel movements are much more normal. And she just looks a lot better than she did when she first came in. So there's a 71-year-old female that came in. She had a lot of problems: chronic fatigue, fibromyalgia, anxiety, depression, suicidal thoughts, poor digestion, constipation, poor memory. So, you know, when you have people like with fibromyalgia, chronic fatigue, poor digestion, there's a lot of symptoms that go along with that. So I found multiple food intolerances, low B vitamins. So I did a very broad test on her to look at her nutritional, her vitamins and minerals. She was not converting her thyroid hormone. She had fatty acid imbalances, which indicated a lot of low-level chronic inflammation, low vitamin K and vitamin D insufficiency. So here's where her past illnesses: thyroid cancer, appendix out, failed low back surgery, bipolar, multiple auto accidents. That's a tough case, okay? That's a hard case to work on. These are some of the drugs she was on right here. So what I did was I corrected her nutritional deficiencies. She stopped eating the foods that she was intolerant to. I gave her Brazil nuts to increase her selenium, did chiropractic on her. And so the results was over a couple of months, the suicidal thoughts went away, the depression improved, back pain improved, and she was able to decrease her medications. She couldn't get off of all of them, but at least she could decrease them, okay? Here's a 13-year-old female. This girl came into me several years ago, and she had mono 12 months before she came into me. Then she got the flu, and she developed these symptoms: daily migraine headaches, persistent vomiting, chronic fatigue, pain all the time in her gut. She had to drop out of the 7th grade. I mean, that's pretty severe. So, and her mother had just gone through a pretty bad divorce. She had no money. So I couldn't do a lot with this girl. I just could do what I could do, okay? So we did a lot of chiropractic on her. She had an autonomic nervous system imbalance. We took her off some food intolerances that she had, and we fixed her adrenal glands because she had a lot of adrenal fatigue. And so I desensitized her to some of the foods that she was intolerant to, gave her some nutritional formulas. Her migraines improved. Her migraines didn't go away completely. They improved a lot. Stomach pain and vomiting were gone. She got her energy back. She was able to finish the 7th grade, go on an overseas mission trip the following summer. So she did pretty well. And here's my last one, 60-year-old female, intermittent, unpredictable, explosive diarrhea for several years. Performed blood work, the TMAO test, which tells me if somebody has gut dysbiosis. She had liver dysfunction, hyperglycemia, elevated thyroid markers. We put her on a gut health protocol plus supplements to support blood work, and after 3 months, she's improved greatly and not experiencing diarrhea a lot, rarely. Okay, so those are some case studies of some people I had. Does anybody have any questions about what I've gone over? Nobody. Okay, so yes.
Do you start with blood testing, or do you mostly start with questionnaires to determine what blood testing needs to be done?
I always start with questionnaires and a case history. Okay. I always sit down with the patient and find out what's going on. Then I do physical exam, and then I send the patient home with a series of questionnaires. I want to know what they eat for a week. I want to know how much they go to the bathroom, how much they sleep, what they're snacking on, what the quality of their sleep is. I want to know what their toxicity levels are. And I have just a general questionnaire about their background. So I do an exam, and I fix what I find on the first visit, okay? I don't do chiropractic, I do organ work and vagal nerve stim if they need it. Then when they bring the things back to me, the questionnaires, I go through all the questionnaires. And if they have any blood work, I want to see that as well. I want to see any recent blood work. I look at all of it, and then I write a report. This is what I found. This is what you came in with. This is what I'm finding. This is what your past lab work shows me. These are the dietary changes you need to make, and this is what we need to do in order to get you well. That's how I run a functional medicine patient through. Okay. Did that answer your question?
Yeah.
Okay, good. Anybody else? So, some of you people probably have friends or family members that are not getting well no matter what they do. And those are the people that I want to at least see or check or talk to. And all of these people here that I just showed you went to many other physicians and did not get well. And I would say this, if you know somebody, most of you do, you're probably thinking of somebody, have them call the office and have them talk to me. And maybe we can help them. Maybe there's a good chance we can help them when nobody else was able to. And for far less money and without any invasive procedures being done on them, like surgery or lots of pharmaceuticals and things like that, other procedures. Good. Anybody else have any questions? Nobody. Okay, yes.
Are there any
Anna?
general ways to decrease inflammation?
Yeah, decreasing inflammation. Number one is eat a whole food diet, a low inflammation diet, and exercise. Okay, those are two ways to decrease inflammation. Low inflammation diet, which I talk about in my nutrition class, which I did a few weeks ago, and exercise. That'll decrease inflammation automatically. Yeah. Exercise, unless you overtrain. If you're overtraining, that'll actually increase your inflammation. But if you just exercise regularly, 3-4 days a week, yeah, that'll really decrease inflammation. Yeah. Okay. Thank you very much. 7 o'clock. I told you I wouldn't keep